Hi, this is AINeuroCare stroke and epilepsy specialist. In the last lecture, we discussed the rapid growth of nurse practitioners. In this one, we're going to discuss about the scope of practice. It's interesting that the scope of practice is very different from state to state. And in the United States, it deals with state legislation as compared to a federal level policy as far as the scope of practice is concerned. First of all, AANP is the lead organization, American Association of Nurse Practitioners, that lead their advocacy group, and it is the largest organization. For neurologists, is American Academy of Neurology. For them, it's AANP. They define that nurse practitioners are licensed independent practitioners who practice in ambulatory, acute, long-term settings, etc. They define nurse practitioners as independent practitioners. This is where the scope of practice comes in. They do not working under a physician, but rather they can be independent practitioners by themselves, which is always some sticking point for physicians. Again, given the overall lack of providers and practitioners within the United States, it's a good thing. However, it comes with a lot of caveats, which we're going to continue to discuss as far as in the whole future CDs, but this is a very important consideration as far as choosing your medical specialty is concerned. Nurse practitioners assess, diagnose, treat, and manage acute and chronic illness. Nurse practitioners are experts in health promotions and disease prevention. All of them are coming from AANP as they define this big umbrella of scope of practice for nurse practitioners itself. They sometimes work under the practice of physicians and sometimes they don't. This was a state-specific practice. So when you have full practice, that means that they can completely independently work as a practitioner under their own license without physician supervision. Reduced practice is that they have like some limitations in which some limited physician oversight is required, and restricted is they need to work under a physician license, period. And this is constantly changing. As a matter of fact, Kansas became one of the 26th states that allows full practice authority to nurse practitioners. Of course, there's a lot of limitations still goes into what is their clinical hours, what kind of self-training they had, etc. But at the end of the day, there are different states who have different models in terms of scope of practice for nurse practitioners. Next time, we're going to discuss all these important questions about nurse practitioners and how the things are moving forward as far as considerations in terms of education, licensing, care coordination, quality of care, etc. So make sure you subscribe to the channel. Thank you. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.